Hello everyone, and welcome back to Rapid Review Rounds. Today we're tackling a topic I find fascinating and incredibly high yield for exams like the MCCQE1, skin conditions whose names can lead you down the completely wrong diagnostic path. Examiners love these because they test a deeper level of understanding beyond just memorizing names. They want to know if you can spot the false friend. We're going to cover 5 classic dermatology deceivers so you can recognize them instantly on your exam and in the clinic. Let's get started. First up is Pyoderma Gangrenosum. The name screams infection. Pyo for pus and gangrenosum for gangrene. Your first instinct might be to give aggressive antibiotics and call surgery for debridement, but on the exam, that would be the wrong answer. In reality, this is a sterile, auto-inflammatory condition. It's an immune system problem, not a bacterial one. The absolute key buzzword here is pathergy, meaning trauma or debridement can make the ulcer explode in size. Look for a rapidly expanding, extremely painful ulcer with a classic violaceous, undermined border, and always connected to its most important systemic association, inflammatory bowel disease. Next, we have Mycosis Fungoides. Mycosis is the medical term for a fungal disease, but there is absolutely no fungus involved here. This is a classic trick. Mycosis fungoides is actually the most common type of cutaneous T-cell lymphoma, a cancer of the T lymphocytes that homes in on the skin. The key is to recognize its slow progression through different stages, from flat, itchy patches that can look like eczema to thicker plaques, and finally to protruding tumors. The pathognomonic finding on biopsy and a favorite exam question is Potrier's microabscesses, little collections of malignant T cells in the epidermis. Number 3 is Granuloma Annulare. Because of its ring shape, annulare, the most common mistake is to confuse this with Tinea corporis or ringworm. The granuloma part might make you think of infections like tuberculosis, but this is a benign, self-limiting inflammatory condition. The single most important feature to distinguish it from ringworm is that Granuloma annulare has no scale. Ringworm is scaly. This is smooth. Look for smooth, skin-colored, or reddish papules that have arranged themselves in a ring, often on the hands and feet. It also has a known association with diabetes. Our fourth imposter is Necrobiosis Lipoidica. Necro implies death and decay, so it sounds like a severe necrotic process, but that's not what's happening. This is a degenerative disorder of collagen in the dermis, with some secondary lipid deposition. The classic board presentation is a patient with a waxy, yellowish, atrophic plaque on their anterior shin. The skin becomes so thin in the center that you can see the blood vessels underneath, and the association you absolutely cannot miss is its very strong link to diabetes mellitus. Finally, we have Tinea Versicolor. Although it has tinea in the name, it is not caused by the same dermatified fungi that cause Tinea capitis or Tinea corporis. This is a superficial infection caused by an overgrowth of Malassezia yeast, which is a normal resident of our skin. It classically presents as hypo or hyperpigmented macules on the trunk, which become more obvious in the summer because the affected skin doesn't tan. The money diagnosis is a KOH prep of a skin scraping, which reveals the classic spaghetti and meatballs pattern of hyphae and yeast spores. All right, let's do a final rapid-fire review. If you see a painful ulcer with a purple border in a patient with UC, think Pyoderma Gangrenosum. If you see an itchy plaque that turns into a tumor, think Mycosis Fungoides. If you see a smooth, ring-shaped lesion with no scale, think Granuloma Annulare. If you see a waxy, yellow plaque on the shin of a diabetic patient, think Necrobiosis Lipoidica. And if you see hypopigmented spots on the back with spaghetti and meatballs on the KOH prep, think Tinea Versicolor. And that's it for our dermatology deceivers. I hope this review was helpful for your MCCQE1 prep. If you found value in this, please hit that like button and subscribe for more high-yield content. Happy studying, and I'll see you in the next review.